Still to come, an exciting breakthrough that could mean the difference between life and death in the fight against breast cancer. Up next, the major advancement in medical screenings being talked about on the Senate floor. October is Breast Cancer Awareness Month, and this morning we're bringing to the forefront the promise of molecular breast imaging in cancer patients. A new proposal is sparking hope for early diagnosis among those with dense breast tissue. And joining me now with more is nuclear medicine physician Dr. Munir Ghesani. Thank you so much for being with us.
You're welcome. My pleasure. Good morning.
So let's start. What exactly is dense breast, and how is it linked to breast cancer?
So first of all, 1 in 8 women in their lifetime will get breast cancer. So it is a significant healthcare issue. And when you look at the incidence of breast cancer in the women with dense breast, majority of them occur in the women with dense breast. And the typical mammograms are not able to detect them. So these get detected at a much later stage, and that obviously impacts on the survival of these women. So it is critical that this particular act needs to pass to allow these women with dense breasts to get the detection of breast cancer in the earlier stage.
And you're talking about the Senate Find It Early Act, which I wanted to get to a bit later, because I wanted to ask you, you said with dense breasts, it's often harder to detect. So that means you need specific
Correct.
equipment to do it that's not always readily available and certainly not cheap. Talk a little bit about how it's diagnosed and just the hurdles that those with dense breasts have to go through to get themselves checked out and treatment.
Yeah, so several years ago, one of the regulations that came in required that the reporting of the dense breast is important when we have standard traditional mammograms being read. But whenever we find that issue, then there are more advanced techniques such as mammograms, which are 3D mammograms, ultrasound, nuclear medicine breast imaging techniques such as molecular breast imaging, and MRI. So these are the techniques that really allow the detection whenever that situation occurs.
So how does the nuclear medicine molecular breast imaging work? That's the one I wanted to focus on today.
Yeah, so, it does not depend on the density. So when you do the standard imaging techniques such as mammogram, they are dependent on the density of the breast. And when the breasts are dense, it is more difficult to penetrate the radiation through them. Whereas the nuclear medicine techniques use a molecular imaging concept. So it's a very small dose of radioactivity, which is injected, and then the patients are scanned after an interval of some time. And that allows us to pick out the cancers at a very early stage, irrespective of whether it's a regular breast tissue, normal breast tissue, or dense breast.
And of course, this is all life-saving measures that can be taken, but the problem is it's cost prohibitive. The Senate is now trying to work on an Early Act, which will, it's called the Senate Find It Early Act, which would help with the costs associated with this. Talk a little bit about the act and what we can do, the call to action.
So the call to action is that if you look at the regulations across the state, there are several inconsistencies, and even within the states, individual insurance companies are very inconsistent in how they cover. So many women who have no important coverage that the insurance company recognizes this issue will not get the test, or they have to get a significant amount of out-of-pocket costs to be able to afford these kind of exams. And that obviously hinders the readiness of a woman to go after that test and get the detection. So the act actually will address the issue by harmonizing the coverage across the states and across the insurance carriers.
And where is it right now in Congress? I know it's not a done deal, far from it, right?
No, it's not a done deal. It is H.R. 3086, but the important thing is that it has a very strong bipartisan support, and organizations such as Society of Nuclear Medicine, American College of Radiology, and others are really working hard to find and fill this important gap in the coverage.
And so how could people help? Do you want them to contact their elected officials and let them know that they want this?
Yeah, so if they can reach out to their elected officials and emphasize that there is a bipartisan support, it's H.R. 3086, and they can write the letter, they can emphasize the importance of this, and if there's more information available, our societies have the information displayed on the website that can guide them. But the most important thing is call for the support of HR 3086.
Dr. Munir Ghesani, information there on your screen about how you can get learn more about this nuclear medicine and molecular imaging. Right there, Dr. Ghesani, thank you so much for the information this morning. We appreciate it.
Thank you. Good morning.